So one of my readers reached out to me regarding one of my posts for OT practice when it comes to chronic fatigue syndrome and whether or not graded exercise should be done as an activity. And in her experience, she had really negative experience. And I want to kind of bring this attention to you therapists out there who may not be aware of kind of the changes in terms of the research and the guidelines. So I asked ChatGPT bot whether they know, and so I guess what the general public would probably ask this question to the bot. So let's see what they're telling the general public first of all to start off. So I asked the question, should people with CFS engage in graded exercise? And the bot responded, the question of whether people with CFS should engage in graded exercise is a complex one, good, and should be approached on an individual basis, taking into consideration their specific condition, medical history, and other relevant factors. So I like that the bot is not giving a blanket statement or recommendation like to go and exercise or not to exercise. That being said, there is evidence to suggest that graded exercise can be a useful approach for some people with, I don't know about this. Graded exercise involves gradually increasing the intensity and duration of physical activity over time in a way that is tailored to the individual's capabilities and limitations. So that is true. The goal of graded exercise is to improve physical function, reduce fatigue, and enhance overall well-being without exacerbating symptoms or causing them. So this is causing harm, excuse me. So I like that they gave this kind of explanation as well. They go on to say, however, it is important to know that graded exercise may not be appropriate for everyone with chronic fatigue. So I like that they said that. Some individuals may have an underlying medical condition or physical limitations that make exercise difficult or dangerous and may require a different approach to treatment. So, okay, I actually like that they follow up with this. So they probably give a disclaimer, yeah, follow up with a professional. So what I wanted to bring your attention to is the NICE and NIC, I don't know how you pronounce this, and basically, they backtracked on graded exercise therapy and CBT in the draft revision to their chronic fatigue syndrome guidelines. Goes on to say, GET should no longer be offered for the treatment of CFS, also known as myalgic encephalomyelitis, also known as ME. The National Institute for Care and Health Excellence, NICE, says in a draft guidance, instead, patients should be encouraged to remain within their energy envelope so as not to worsen their symptoms, it advises. So I'm not going to go into the CBT part, but I looked around the internet and see what people had to say. For example, one of the articles on Reddit posts said, has anyone had a success from benefit from exercise? And actually the very first most upvoted post is, there is no evidence that graded exercise is beneficial for ME CFS. It is most likely even harmful. And there's a Stat News article here. They want to say graded exercise has now been removed from the CDC guidelines for ME or CFS in the United States and is also removed from the NICE guidelines. So we just saw that it was removed from the NICE guidelines. Those of you who are interested, I have it in my article. Let's see if I can pull it up. Those of you who are interested, you can find it here. See this. What does it say? Basically, probably what I just mentioned, right? NICE recently published its updated guidelines for this and concluded after an extensive review of the literature that graded exercise, GET, graded exercise therapy, is harmful and should not be used, and that CBT is only an adjunctive and not a curative treatment. You can read this if you're interested, and let's see what the CDC has to say about it. They go on to say for treatment, there is no known cure. Let's see what they had to say about exercise, if anything. Rehabilitation specialists or exercise physiologists who understand ME, CFS may help patients with adjusting to life. Finding ways to make activities easier may be helpful, like sitting while doing laundry. So, hey, this is what we do as, hey, it doesn't mention occupational therapists, but yeah. Some patients find heart rate monitors useful in keeping track. So yeah, biofeedback devices, self-monitoring is very encouraged, very helpful assistive technology. Patients who have learned to listen to their bodies might be able to increase their activity level. So notice they didn't really say, oh, here it is. Exercise is not a cure for. Here we go. Straight from the CDC. Exercise is not a cure for ME/CFS. any activity or exercise plan for people with ME/CFS needs to be carefully designed with input from each patient. While vigorous aerobic exercise can be beneficial for many chronic illnesses, patients with ME/CFS do not tolerate such exercise routines. And look, they even put it in bold. And they're going to say standard exercise recommendations for healthy people can be harmful for patients with ME/CFS. So there you have it. What people are saying instead, I think it's important, besides, looking at the research and the, what the professionals say, it's really important to consider the patient, right? So it's hard for someone to online to find this. So the next best thing is to look on Reddit, right? So for example, there's actually a chronic fatigue syndrome subreddit and so on. For example, Child John said, I would say that before I was diagnosed, I was constantly told to lose weight and exercise every day to feel better, and that I felt worse in every way. So I'm assuming that's what you mean here. The whole thing about CFS is doing what you're capable of. Now, this might not necessarily be a patient. It might just be someone, it's the internet. We don't know who's actually posting, right? It may be someone with the lived experience with CFS. It might not be. So just keep that in mind. Some people, basically, they're saying that everyone is different. Depends on what your priorities are. If you're able to exercise, you decide if it means enough to you to spend basically what you should spend your energy on, right? So energy conservation. So for you OTs out there, energy conservation is pretty crucial to this client condition, or people with similar conditions, I would say, even like chronic fatigue syndrome, fibromyalgia, things like that. Even though that's necessarily a different diagnosis, at the end of the day, all these conditions, they share really similar symptoms too. So even though the underlying etiology is different. So I'm currently at the start of heart pacing. The idea is stay below my aerobic threshold. So before I maybe I want to go deeper diving into what this, Reddit can be a rabbit hole. I wanted to point you guys in an email that I actually received from one of my readers. And I'm going to keep this person anonymous, but they are a healthcare provider. So they have a healthcare background, and they were diagnosed with maybe CFS ME, maybe something else. Guidance on this condition has changed a lot. And I think it actually made my symptoms worse. As I worked with a physio and rehab staff, they encouraged me to undertake exercise to try and help me get better. So yeah, the best of intentions. But what happened? They said that I remember being on a watt bike crying because I was feeling so unwell. My heart rate would creep up to basically become really, really quick, tachycardic. And they were standing there trying to measure their heart rate and stuff. And all the time, they were having a lot of anxiety. They were crying. They were probably in a lot of pain. So is this necessarily the best intervention? Like a blanket one? I don't think so. Just like how ChatGPT said, it depends. And you want to be careful to not exacerbate symptoms or cause any harm. So it's easy to go over, I think, as, especially physical therapists, occupational therapists out there who are used to exercising and prescribing exercise. In general, yes, some activity is good, but for people with CFS and very similar conditions, maybe long COVID, fibromyalgia, etc., they have very limited amount of energy, and they have to choose really wisely how they expend it. So the P's, right, pacing, energy conservation, planning are very crucial here. Well, one person said, exercise can be so dangerous for this disease. Please listen to the experts and not her on this. And blah, blah, blah. Exercise, especially if you're already severe. So of course, I didn't mention this, but there are different stages and severities of just like any condition. With CFS, this applies as well. It has the potential, this exercise, to put you in a very severe, permanently degenerative state. I don't know about this. I haven't looked into this statement or claim, rather, but it is possible. Let's see. I find benefits, so they're probably a patient with this condition, in concentrating on building strength and muscle mass, so low reps. So they are doing some exercise. So there are ways to do it. We don't know what their severity is. If I overdo aerobic activity, symptoms worsen and performance tanks really quickly. I'm very sorry that your partner is pressuring you to exercise when it's making it worse. So I guess what the upvoted. The exact same experience as well. As a student of exercise science and strength training, I've obsessed over how to increase my strength, blah, 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 having CFS. Keep the exercise within your energy budget. Exercise made my butt look nicer, but it didn't matter because it also made me bedbound. Well, you see? So I think this goes with one of my points that I often make in my chronic pain videos is this notion of no pain, no gain. I think a lot of people have been taught this, maybe in school, they hear it. It's popular. It doesn't apply to any condition, I think, whether you are sick or like just 100% athlete. Let me backtrack on that. If you're an athlete, you know, you're going to have some pain to achieve those goals, or you're like an Olympic professional athlete, right? But for most of us who aren't, especially if you have chronic fatigue syndrome, no pain, no gain does not apply. Do not listen to that saying. Listen to your body instead. You don't want to just overexpend, overdo it, overhurt yourself, and just cause your symptoms to worsen, I guess is what we're actually seeing here. And actually as stated by like the NICE guidelines. I also want to know in your comments what your kind of experience is with prescribing exercise. If you have done it, have you had some kind of horror stories, negative things happen? Let me know in the comments, and let's all learn from kind of some of the anecdotal evidence. It's probably going to agree with some of this. And those of you who are patients, if you're watching this, feel free to chime in as well. So thanks for watching, and let me know what you think of all of this.